All right. Welcome, good afternoon. Welcome to this emergency meeting of the, well, thank you. Welcome to this emergency meeting of the Palo Alto Unified School District Board of Trustees. Today's date is March 12th, 2020, and it is 4 p.m. First, because some of the board members are joining us electronically, we'll do a roll call to see who's here. And I'll call the roll. First, Mr. Dauber.
Yes, I'm here.
Ms. Bates Caswell.
Yes, I'm here. Would you like my video to be on?
Doesn't matter. Video? Okay.
Your choice, Ms. Bates Caswell. Ms. DeBrienta.
Here.
Mr. Dara. Here. And student members are with us, but they're not mic'd. And so, but Mr. Chang, Ms. Chang, and Ms. Gordon, Mr. Gordon are here. Okay, opening comment. Before we go on to our main items, let me set this up. First, the basis for an emergency meeting. Due to the ongoing and escalating public health emergency related to the spread of COVID-19 in our community and around the world, and the need for rapid response by district staff and schools, a majority of the board has found that an emergency exists under Government Code Section 54956.5. Based on that, we've convened this emergency meeting. The effect of an emergency meeting is that it reduces the public notice requirement and allows us to hold a meeting the same day. Otherwise, this meeting follows the same format and requirements as what's known in our parlance as a special meeting. I want to acknowledge the efforts of staff, our partners at Mid-Penn Media, our local press members for reacting quickly and providing the board and community with a chance to see and participate in this session all at the same time. There are three goals for this meeting. One is an opportunity for staff to update the board and community on the current status of our schools and the recent impending measures to address the impact of COVID-19. Two, provide an opportunity for board members to ask questions and provide input in a shared and open setting. And three, provide an opportunity, if desired, for the board to give staff direction in terms of COVID-19 response, though I'd say there is no need for the board to act today unless they choose to, or we choose to. So in a moment, I'll hand it over to Dr. Austin for the update. Then after the staff update, we'll hear any public comment on this topic following our usual procedures. And then we'll move on to board questions and comments. Does that all sound good and appropriate? Okay, then Dr. Austin.
All right, I want to touch just two operations pieces, and then we're going to hear from Ms. Conway to get us started. Then I'm going to take it back from her and walk through the rest of the highlight pieces. As we got into this attempt to work through coronavirus, just like everybody else in the nation, it takes a little while to figure out how things operate and how we should best work as an organization. At this point, though, we have identified a point person. Ms. Conway is going to be our district coronavirus point person. That just helps us have a single point of contact for questions about the technical or the implementation steps related to the virus. Derek Moore is now our point person for all communications efforts, which means anything that goes out to the community will run through Derek's office. That does not mean Derek is charged with writing everything or producing everything. It just means everything communications related will run through him. So in just a second, I'm going to kick this to Ms. Conway, who's going to take us through kind of the big picture pieces of our understanding of coronavirus, county guidelines, and where we are currently. And then I'm going to walk us through the rest of the organization, ending with the letter that we have prepared to go out to our community at the conclusion of this meeting, and to talk about a couple things that are under discussion with all of the county superintendents. So with that, Ms. Conway, why don't you go ahead and get us started?
Thank you. So as you know, the COVID-19 situation continues to evolve pretty rapidly, and both district and site level leadership are trying very hard to respond efficiently and effectively while still instilling calm, amongst our staff and our families and our students. What we know from the county public health officials is that the COVID-19 response has shifted from prevention strategies to mitigation strategies. And that basically involves those steps that all community members take to ensure that they are doing their part from an individual lens to both protect the community and themselves. So the major goal of these mitigation strategies is to make sure that we're focusing on those individuals who are in the age bracket that put them at higher risk, and also those individuals who have health conditions that place them at a higher risk. So that's the focus, at both a county and a federal level. The entire PAUSD community, though, is integral on that part. Some of the concerns we've heard from the community are related to students potentially getting infected and taking it back home. And so I've been responding to quite a lot of emails surrounding that. But this involves the responsibility of every single individual. The location matters much less. The CDC has been extremely clear that closing of schools, for example, is not as much of a mitigation strategy as people might think it is, because obviously if students are in school, we're able to practice social distancing and other measures to help protect students. They have also put out some additional guidance that indicates the reasons why it would not be wise to close schools in some communities. Some of that is to do with equity, but that's not the only issue. If students are still out and about in the community and not self-isolating, they are still just as at risk or exposed to potential infection as they would be in a school environment. So it's important for our community to know that within the space of the school walls, we're able to establish some conditions that would mitigate the risk of infection. Our role right now is not to prevent it. We can't. But our role will be to make sure that we're slowing down the transmission of the infection and making sure that we are providing the necessary support and education for our students and our families to protect themselves. Unless there's anything else, that's really the only update I have.
All right, I'm gonna just walk us quickly through the different divisions. So I'm gonna start with HR, and I'm gonna be the person that just goes through these, and at the end, if you have specific questions that I can't answer, we'll kick it to staff. So HR is still gathering understanding and information for inquiries of what our current state is. We're trying to provide accurate, consistent, and caring responses. Trying to forward think on what the next set of questions are. So when it comes to human resources, a lot of those questions are dealing with things like receiving of pay, leaves, what to do in the case of a closure, some of those things, and everyone in the county is kind of in the same boat trying to work through those. We've reviewed our collective bargaining agreements, met with the association presidents, and received counsel from our attorney. In the area of communications, again, we're working to communicate quickly and accurately. That's been a group effort, and some of that has been assisted through the county more recently. As it relates to technology, our infrastructure is excellent. So as far as our technology infrastructure and devices, we are in probably the best shape of anyone in the county. Our training and ability to replicate classroom instruction is a fraction of what it will be someday. All to say, we are not positioned to replicate classroom instruction virtually or independently at this time. It's my understanding that nobody in the county, and I would presume very few in the state, are. Fiscal, business, and maintenance, we're trying to make sure that people understand that limiting social interactions at school also extends beyond school. So in any social setting, we want to clarify that we have no issue with cleaning supplies, meaning that we have a surplus of cleaning supplies. That is less true of supplies that we did not previously use, meaning alcohol-based cleaning supplies. Those are in short demand, and we're working through that. A little technical piece, J13 waivers are looking like that's going to be a reality. A J13 waiver essentially waives ADA minimum requirements for instructional minutes. So if at some point through the guidance of the county, we have to close for some period of time, and presumably the entire county would be under a similar order, we would not have to make up those minutes at any point in time. There would be a waiver through the county. Flexible learning options is a term you're going to start to hear quite a bit here. Flexible learning options could mean a lot of different things. In our case, it's going to be a combination of online tools along with more traditional paper, pencil, books. That combination will allow for options outside of having to necessarily show up to a school classroom each day. Right now, we have about 60 of our employees. Those are principals and our instructional leads. Next door at Palo High School, they are not all Palo employees. We're using the facility at Palo to do the work. Our instructional leads are working with our principals to put together packets of work, some, I would say, Band-Aid efforts to get us to spring break. I'll talk more about that in just a minute. The county, just for context, contacted me early this morning before 7 o'clock and asked if Palo Alto would be interested in becoming the first district in Santa Clara to offer flexible options. Meaning, they believed, as I do, that if anyone can do it, it would be us. Other districts could have different challenges, and it's not that we're challenge-free. We have many challenges, which we'll talk about. But the idea that coming to school is still the first best option. The county has no intentions of closing schools at this point in time. There are a lot of reasons for that. I'm sure we'll touch on some of those here shortly. But given that some people are choosing to stay home, and that number could grow, and some people have circumstances at their home or personal lives that would make sense for them to stay home, we are going to be the first district in the county to allow for flexible options, meaning if you stay home, that will be allowable. Not recommended, but allowable. Again, the bridge programs that we're putting in place are not a replacement of classroom instruction. There is no expectation that one day at home using our activities and our lessons will in any way match the classroom instruction being lost. But it is an effort to keep some consistency and continuity with being involved with our school district. Elementary, the elementary program as it stands right now, again, it's evolving, will consist of home study guidelines with resources, including links to free resources. We'll be focusing on reading, writing, math, and enrichment. Basic expectations for work for grades TK through 5. Again, the last I'd heard, and this is still evolving, is we're shooting for somewhere 5, 6, 7 hours of work for a week being assigned through the school district just to kind of keep your feet in the school zone. Of course, parents can exceed that and do more, but as far as creating, preparing lessons that replicate the school days is not going to happen. At the secondary level, again, flexible learning options, including making use of existing tools such as Schoology. We are a little bit better positioned at the secondary level to have more continuity. We are exploring things like course completion criteria and other unknowns, such as administering AP exams. We don't know what's going to happen if we're in the middle of a closure during AP exam time. So that's not something that will be unique to us. That's something that we are handling as an entire county. As it stands right now for cancellations, as of today, all athletics are suspended for the entire athletic conference. There's discussion about if practices will be allowed or not, and as of right now, I think there's a little confusion on that, so we'll have that clarified by tomorrow. All extracurricular, non-essential school activities are canceled. Field trips canceled, dances canceled. That includes prom, that has been messaged out, or is in the middle of being messaged out from the school sites. And group activities will be canceled. The letter that you have in front of you and our audience has was created in coordination with the county. Explains the concept of flexible learning options. Makes it as clear as we can make it that our hope is that students still attend our schools. And finally, I have permission to share that the county is just exploring a 2-week county-wide consistent spring break. And if so, all of the options that have been flown at this point fall within our existing spring break and then either a week before or after. I think if I had to guess right now, the week before, if anything, seems to have the most momentum. That is not a done deal. That is not something we're doing on our own. It only makes sense to do something like this if we all do it together. My final thought before I turn it over to the next phase of this meeting is there is a huge difference between a dismissal and a quarantine. Just dismissing our school does not do anything as far as quarantining. In fact, there's a school of thought that releasing students, in our case over 11,000, into the community without having supervision and being quarantined at home could literally do more harm. So there's a huge distinction between those two things. So for that reason, our county's desire is to remain open, although we understand attendance may dip. So I'm going to stop there and expect questions after we get into this.
Great. Thank you all for that update. All right, we'll move to public comment. We have 2 speakers, and each one will have 3 minutes. Meb Steiner and then Jay Chow.
Good afternoon. I'm Meb Steiner. I am president of CSEA Palo Chapter 301, representing our classified staff. I am also going to ask a couple questions on behalf of Terry Baldwin as she is homesick. So first, I really want to start off by saying that all of our classified staff and we as leadership stand ready to work together and get through these tough times, and I appreciate the conversations and the communication lines. We in fact met earlier today with Ms. Hendricks and with Ms. Chow to talk through a few things. I think our emphasis, as we all tend to naturally do as educators, was first to focus on children. And that is absolutely critical. They are our number one charge. But it is really, really important that we have a plan for our employees. We have teachers and staff at high risk. If they themselves are not personally at high risk, they may have people at home who are high-risk individuals. And so currently what's happening is folks are gonna have to use up sick days, maybe go on a medical leave, which results in differential pay, which is very hard loss of income. Another question is what happens if a child's district decides to close, but ours doesn't, and then you're working and dealing with childcare. These are issues I think that affect folks around the community. I do want to point out that particularly classified staff is very much on the front lines. Our custodians are running. They are running. I know we've ordered supplies. We need more. They need more masks. They need some protection. Our nurses, critical. I really urge us to have our nurses at any decision-making table because they have our local school district, local community insight. They are also quite overwhelmed. I will let you know right now, we are triaging students in the hallway in the tower building because we had 14 to 16 of them sitting around in the wellness center coughing on one another, waiting to try to see the nurse. Also protocols around cleaning our buses. I know some new supplies have been ordered because that's a critical piece as well. So we need to really get on that. And I know we will continue discussions around making sure our employees, have income and health care so that they can keep their families safe and fed and make sure that they get the medical care they need. So once again, I really want to emphasize thank you for this meeting, for the communication, and we stand ready to partner and get our entire community through this. Thank you.
Great, thank you. Jake Chap.
Good afternoon, my name is Jade Chow. I'm the president of Alto PTA Council. I wanted to share the information that we in the PTA have been circulating amongst ourselves and what we have been doing. And as a result of that, our cooperation and support for the district as well as the district leadership in responding to the COVID-19. First off, our focus now has shifted from monitoring the situation to taking proactive steps in an effort to support our PTA leaders. With the new information being shared daily on this rapidly changing public health crisis, we understand the situation is continuing to evolve. For example, we have had a number of telephone conferences with our PTA leaders on a regular basis and continuous basis for about the past 2 weeks. And we have been communicating infection control as directed by global, federal, state, and local health officials, as well as our school district's officials to be practiced by our PTAs. And this includes social distancing, respiratory etiquette, and how to ready our systems. At this point in time, we also want to communicate that we are supporting you, our school district, for any and all of the containment or mitigation strategies that the school district shall take in response to the spread of COVID-19. We are looking to you as our leaders, and if it is helpful, we would be supportive of making requests for a special school board meeting just to focus on this topic. We would also be supportive of a board resolution outlining our school district's top priorities and any coordination and communication in online learning. We appreciate the ongoing communication that you have given us in a timely manner and the transparency in your decision-making process. We appreciate all the planning that is being made to ensure that our students are learning in a healthy and safe situation. The sharing this information with us is what we are looking for, and we are working together and want to work together with you and as well as our community partners to protect the health of the public and those who are most vulnerable around us in our school families. Thank you.
Thank you. No more cards, Vicki? Okay, so that is public comment. We'll turn to board member comment and questions, and why don't we start with the people on the phone. How about Ms. Baden-Caswell?
Hold on. Can you hear me?
Yes, very well. Thank you.
Oh, terrific. First of all, Don and senior staff, I want to thank, this has been really stressful, I know, and really appreciate all the work that you've done to try to look at every different risk that we possibly have here. There are a couple of questions that I have, and I appreciate your new guidance on athletics and on the teaching and learning for students that are not at school. So I think that's going to be helpful, and I appreciate the time that the teachers are going to spend on this, because this will be extra time and effort. I think we all have to be aware of that. That we do have some teachers that have high-risk health issues, and I'm wondering, Dr. Austin, if you could talk to that, or maybe Ms. Hendricks, how are they being supported? And specifically, I know that at least one teacher has reached out and asked if it would be possible to teach from home through distance learning.
Thank you, Ms. Baden-Caswell. So we do have processes in place to take in information from employees related to illness, use of sick leave, and requests for any kind of leave. What we're doing is processing individual requests related to our processes, if that makes sense. So when we receive an inquiry from a staff member, we speak with them, communicate with them, find out what their need is, if they have restrictions related to their need, and then the process from there would be an interactive process to see if it's a restriction that we can reasonably accommodate related to their job description. So all those things are very individual conversations, although the practices in place are consistent. We're encouraging staff to reach out to us when they have concerns because we understand the concerns and worries. So we want them to please contact the Human Resources Office. We're there to understand and support them in making sure they understand what they are entitled to related to sick leave as defined in the collective bargaining agreements, and also the different types of leave that are available, which is a very technical process.
Ms. Hendricks, many of our teachers have children, and if they have children in a district where outside of our county where they close schools, how will we handle our staffing needs for those teachers?
I think there's two questions there. One is how will we handle their absences, correct? And they can rely on use of personal necessity leave or family care leave. The other is how do we handle the absences in terms of substitutes and teachers in place. And so we work on both of those components. I gotta say our staff has been just amazing, exemplary the last couple of weeks. The staff attendance has been stellar and we're so appreciative of that. If we find out staff have needs related to their own family, we'll support them in understanding what they are entitled to use for those type of leaves, and also work on making sure we have substitute teachers or guest teachers in place to provide ongoing education for our students.
If a teacher has a question about this, should they be going to HR or to their principal?
They're welcome to come to Human Resources. I think in many times they're talking to their principal, first thing, which is very appropriate. And then they can contact Human Resources for the technical aspects of what they're asking. I'm available, certificated Human Resources Director Lisa Hickey is available, and classified personnel director Ann Lay is available as well.
Okay, I have a question for Dr. Austin. We have some portables in some of our schools that do not have sinks. How are we handling cleaning supplies in the classroom for teachers to have available for those portables that don't have sinks? I know soap and water is the best thing, but if you don't have a sink, what are we doing?
So I'm happy to respond to that question. And as far as the classrooms that do not have sinks, as we know, washing hands thoroughly and frequently has been the best recommendation. But in lieu of that, for those classrooms, we do have gallon-sized containers of the alcohol-based hand sanitizers. The cleaning supplies are generally on the custodian's cart and move with the custodian when the custodian is cleaning at the end of the day. Spray bottles and microfiber cloths have been made available to the classrooms as requested basis. So they would have those available to them as well if they wanted to do anything in between custodial cleanings.
I know that in the elementary school classrooms, teachers are stopping class at multiple times during the day to have their students lather up with soap and wash. Have we been giving any guidance at the secondary for similar process? By the way, we've gotten a lot of compliments about that, particularly the elementary process.
If you're asking about specific guidance for washing hands in between activities at the secondary level, the answer is no. There is no guidance for that right now.
Okay, I'm suggesting that we might want to take a look at what would be a reasonable guidance around that. As many of us know, many, and maybe soon all of the colleges with dormitories are going to online learning across the country, which means a lot of students are coming back to Palo Alto and are going to be around. I know they're not our responsibility, but many of them went to our schools and will probably try to connect with their people. I'm sure we haven't thought through this yet, but I wonder if that's something that we can just, as we're doing communications, maybe make some suggestions there. Does that sound reasonable, Dr. Austin?
I think there are two issues there. Number one is that's exactly what we're talking about, that a release is not a quarantine. So that's a perfect example. Number two is we have very strict guidelines in place effective immediately about visitors on campuses. They won't be allowed on campus or in any rooms.
Okay, I just keep this in mind because you'll see them maybe not on campuses, but are our campuses open? Can students still leave and go to town and country in the middle of the day from Halle, for example?
Yeah, at this point, that is our case.
Okay, that may be a challenge for us to think through. But my final question is, and you can wait till the end to talk about this, but there may be some decision making that has to happen at a strategic level. And what should the board expect in terms of how we will be included in that decision making? Every board meeting probably is not the right.
Yeah, and there are a couple answers to that. First of all, the board can direct me and the staff any way that you would like as far as updating. But as far as decision making, we have some pretty clear guidelines about my authority and what needs to come back to the board for formal approval. I think we had a bit of an anomaly in that this was a 3-week gap between meetings. Otherwise, we're usually 2, and we can always call for a special if the conditions change. But for the most part, my investment of time right now is more with the county and all superintendents, and then relaying back anything that's coming out of those meetings. For everyone, for a quick example, the decision to cancel athletics was done today in the meeting with all superintendents, none of which we're planning to take that back for a special board meeting, board votes. And there are going to be lots of those kinds of decisions, and we just have to know kind of how comfortable the board is and how far I'm going to be able to make some of those decisions.
Okay, well, I would hope that more communication to board members rather than us would be sort of your strategy. I really, really am happy that you're working with other superintendents in the county, and I want to thank you because I know that's just adding one more thing on your plate, but thank you.
You're welcome. Thank you.
Great, thank you, Ms. Big Castle. Moving on to Mr. Dauber.
Hi, thanks for the clarity. I had a few questions. Can you describe what attendance is looking like?
Sure. I'm going to give you some general numbers. Our secondary schools are holding pretty solid, as high as upwards of 97%, but all of which in the mid-90s. Elementary schools have declined. They're much more in the range of the low to mid-80s with a couple in the very high 70s. That's been relatively consistent. There's a little drop here recently, and district-wide we're shade over 90%.
Do you have any idea how the flexible learning options might affect attendance? Like any sense about expressions of interest along those lines?
Yeah, I'm going to expect a decline in our attendance. I think that's pretty safe bet. The extent of that decline, I don't know. I think if I'm having to make some projections, I would say the decline will likely be more significant in elementary than secondary. I think there's a different perceived importance of being in our secondary schools with the content-specific instruction. I'm not endorsing that idea, but I think that that's likely the way it will play out.
You've been talking about the county health department and the county office of education. I mean, those aren't typically organizations that we hear much about, particularly the health department. Can you just describe kind of what their role is and what role they've played in our decision-making process?
Sure. I'd say what's unique right now is the way the county public health department and the county office of education are working hand in hand. That is not the case in my peers' experiences across the state. That the two are disjointed and giving in some cases even conflicting or no guidance. Ours are now completely coupled, which is nice. Now, good news for us is we have the additional benefit of the public health department's lead being a PAUSD resident. So our access is better than most in that regard, but the two work beautifully together right now in our conference calls and Zoom meetings and even in face-to-face meetings. Both are routinely available together at the same time, which has been really nice.
How frequent is your contact with them, staff contact?
Increasingly. So as far as dialing in for conference calls, it's been pretty frequent for the last 2 weeks. But it's definitely accelerated. I'd say Palo Alto is seen as a school district where a lot of people are going to watch what we do. And because of that, both the health department and the Office of Education have high interest in knowing what we're doing and helping to guide and support us because others will follow.
So they seem to be coordinating well with each other, and we have pretty frequent communications with them. So you're happy with how that is going in terms of communication and coordination?
I would say especially the last week, I'm very happy with that relationship and the way that they are working together, yes.
What about contingency plans in the event of school cancellations? How is that? What are we doing in that regard?
Yeah, so that's phase 2, and we're really poorly positioned for school closures as a whole. And the idea there is if we go to full school closures, it is likely that closed will mean closed, and that is very common across the county. For example, if we go to a 2-week spring break, it will feel like 2 weeks of spring break. It's not going to feel like 2 weeks of spring break and 1 week of virtual instruction. So that will be a big difference.
So we really aren't, what I said before, we're really not well set up for, conducting distance education or trying to conduct the educational mission of the district in a closed or students not on campus kind of mode.
No, we definitely are not, and neither is anybody else right now. Universities are much more in tune to learning management systems like Canvas. Some universities already had courses available. We're just not there yet. I think we will be someday, but not in the short term.
Right. What happens? And I don't know if there's an answer to this at this point. But what happens if a student or a teacher or even a parent of a student tests positive for coronavirus? What happens?
Yeah. So as far as school closures, there is no predetermined trigger for the entire county. What it does trigger is an immediate call to the county and consultation. And let me tell you why, just for everybody. There is no blanket answer for that. A student at an individual school with a positive test, let's say this happened, what did happen in Marietta Valley in Southern California, they were able to identify 71 individuals that they thought had contacts sufficient to send home. They did not close the entire school. They did not close the entire school district. Elk Grove had over 60,000 students. They sent home the entire school district. It could be that we have an individual we can isolate like Marietta Valley. It could be that we have an individual that the second we start to dig into it finds out that we have siblings at 2 schools, rode the bus, and that exposure is beyond our capability of controlling. So for that reason, I know no one wants to hear this, it's just not as black and white as people may want, but the part that is black and white is an immediate call to the county. We have cell phone numbers, so we go straight through. Very, very quick action and instant communication. If we have any confirmed cases, that'll be communicated with everyone.
So essentially, we would quickly consult with the county health departments and very most likely take their advice. Is that?
Yes.
Yes. Okay. 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 Good. That's it for me. Thanks.
All right, great. Thank you, Mr. Dauber. Ms. DeBrienza.
Someone else will have to comment.
I
Thank you. I want to also thank Dr. Austin, thank the entire staff, thank all the administration, all our school sites, our teachers, our classified staff. Over the past couple of weeks, I mean, everyone has just been working so hard and trying to serve our students while being stressed about the news and what's going on. And it's been really hard. And it's just been clear that we have a staff that is here for our students, and we're really grateful to them for all they are doing. Meb just talked about a bunch of examples of staff going above and beyond. I know you guys have been here early in the morning and late at night, and we're really grateful to you for that. Thank you. Mr. Dauber asked most of my questions. Thank you, Mr. Dauber. One of the things that I think was really interesting that you pointed out, and I know that we discussed, I think when Menlo School first closed, was this difference between dismissing students in quarantine. And Menlo School closed a few days ago, and there were many students congregating at cafes and whatnot. And I think that's really important. I mean, the idea of trying to do social distancing is to really reduce these touch points and interactions. And it's really important that if parents are going to keep their kids out of school, that they actually keep them home. And I do expect that families who have voiced concern will do that, right? They want to keep their kids from interacting with other people and possibly being vectors themselves. But I think that's an important distinction, and we don't really have the ability to tell everyone that they have to hunker down in their home and not leave it. So thank you for just calling those out, because I think that makes a difference. And then I just had some similar questions for Ms. Hendricks about if teachers have kids that are either in vulnerable groups or their schools have closed, and it sounds like that's a one-on-one conversation as staff, whether they're teachers or classified staff, if there is a concern about their own health or the health and safety of family members, if it's medical leave or family care leave, that's something that you want them to come to you for that, right?
Absolutely. At any time, any point in the school year, if there's an issue for an employee with their family where they need time to provide care, take care of family members, we work with them on those issues.
Okay, thank you. I have all my other questions are asked. Thank you.
Mr. Garrett.
Thank you. I'd like to echo the thanks to staff for really working tirelessly on this and continuing to do the work of the district, which is educating our students. It can't be an easy task to do both. I have a couple of questions. The first is kind of a big picture question, and I don't expect a detailed answer at all, but we know that Seattle, which had many more cases than Santa Clara County does, closed its schools. San Francisco, which has fewer cases, or at least diagnosed cases, closed its public schools for 3 weeks. And then we've seen a couple of states, I think Ohio and Maryland, have closed their public schools across the state. And so my question is, and I don't expect a full answer, but how are we different than that? We have a significant number of cases in Santa Clara County. Are we taking that into consideration? And as a caveat or context to that, there's been a lot of discussion about how organizations like the CDC and other health organizations in other states may have been behind the curve in dealing with the outbreak. How are we making sure that we're not behind the curve, kind of approaching with a critical eye the advice that we're getting from all of the different agencies, federal, state, and county? It's a heady question, I know, but...
Well, I want to give you a simple answer. We're putting our trust in the health experts that are put in those positions to give us direction. a shorter answer to, how do we know if we're essentially right or wrong? I think that's just going to be determined by whoever's hearing the message, right? The coronavirus is going to spread. I mean, it's an undeniable fact that it's going to spread. Will it hit our schools? I mean, it would be silly for us to say it's not. I mean, we're going to do everything we can on our end, but controlling the spread is not even a goal for the health department. It's slowing the spread. In their opinion, our best role in that is to stay open as long as possible and to do exactly what we're doing. So I think actually, Mr. Rob, part of what I'm trying to do is to not go through and evaluate everything that's sent to me, because like anything else, you're going to find conflicting information. So I'm going to stick with the advice of the professional that's put in the position of authority for us.
Thank you. The flexible learning, so my understanding is it correct that parents are going to be able to pull their students out if they need on a rolling 10-day basis? So 10 days of absence, and then they have to re-notify the district that they're keeping their student at home?
Are we that far on that?
Yes. I can respond to that. The whole purpose of that is to make sure that we have strong tracking practices in place. So currently, we've received guidance to mark absences as unexcused. I'm a little bit challenged by that as we look at the condition that we're in now and how rapidly things are spreading. Our initial guidance was that parents can opt to keep their kids out of school, and they would get an excused absence under administrative discretion. But they have to, in order to do that, they have to provide written notification to the school with the start date and the end date, not to exceed 10 days. And if they wish to continue that past the 10 days, then they write another letter just to let the school district know so we're properly documenting what the conditions are. I will have to say that guidance may change, but at this particular point, we feel like it's in the best interest of our students since we're giving them the option to do it. We can't give them the option and then say we're going to mark you unexcused. But that still is obviously under discussion. But right now, that we're marking them as excused.
Okay, so it will be excused for now. Okay. And then the last question, which is a little bit in line with Mr. Dauber's question, as you said, the mitigation measures that we have aren't in a vacuum. What is our relationship with the city and what the city is doing in its efforts to contain and mitigate the spread?
Yeah, I can work on that. So I mean, with the city manager, got a call today. They got pulled away for a little bit, so we rescheduled again. But the city's, and when I say the city, I mean the city manager and I are in consistent communication on all things related to the relationship between the schools and the city. For example, they run the city basketball league for middle school. They run our middle school athletics program. That is also canceled right now. So we'll be talking further, but when they have announcements or things, they give me a heads up. I do the same, and we're going to be doing some additional problem solving.
And then another question about the flexible learning. So how does our flexible learning accommodate or support special education students or students who have additional resources or supports that we have for learning? And sort of with that as well, how are we supporting BTP students or students who are in family engagement program, which is probably not social distancing? So
I'll give you the first part, then I'm going to have somebody else prepared for the special ed answer. If there is an answer, I just want to make sure it's totally accurate. As far as BTP, we had our family engagement specialists will be reaching out to those students as needed, and Ms. Conway's really done a great job of bringing in her whole team around that work. The first thing we did is to check to see if there were device or connectivity issues for the online pieces. There are not. If there will be so few that we can mitigate those right away, but our understanding is that we're overwhelmingly in great shape there. For special ed, I know we have a very specific answer. Sophie, do you want to take that?
Sure. So, for families who choose to keep their students out of school, that we're not replicating what's happening in school, and there has to be recognition of that. And so our special ed team is working with our special ed site leadership around communication of that to families and documenting that in their IEP documents. So. Just acknowledging and noting that this is a choice that the families have made, and that by missing school, it's not the same as being in school, and so the services being provided are different.
Okay, thank you.
Great. Why don't we give Mr. Gordon and Ms. Chang a chance to speak, and you guys can just speak from the podium.
Good afternoon. This is the first time I've ever done all of this. It's pretty exciting. I wanted to start with kind of a general statement, speaking from a Palo student perspective. I think recently a lot of students have been kind of coming together saying, I don't want to be here on campus today. And there's a mix of emotions because there are students on our campus that do not feel safe sitting up near other students and constantly touching the desks and the pencils and the erasers and stuff like that. But I think that the majority of our high school students at Palo are using this coronavirus almost as a scapegoat for not having to be on campus. And like Ms. DiBranza said, having the day off and going to the coffee shop and going to the pool. And I do not think that the majority of our students are using this idea of getting out of school to self-quarantine. I think in the result of a school closure, our students will be active in the community and out for bike rides and still seeing their friends. As for whether I think our school should be closed or not, like Dr. Austin said, I think we'll leave that up to the health experts. One question I do have for Ms. Ofek, what are we doing right now with our early childhood development programs? Because I received a text message today that gave a hint that there were Palo students on elementary school campus.
Right, so we're maintaining what is essential to the learning of that course, and a part of early childhood development is visiting and working with the students they work with every week. So those particular students continue to do that work.
So in a situation where one of our Palo students and or one of the elementary students do contract the virus, then we're essentially, like Dr. Austin said earlier, giving a lot more opportunity for this virus to spread. So I would recommend that we look into how important, essentially these daily visits are, and whether we can transition to more of like a lecture-based 2-week period, 3-week period, where we just don't have that interaction between our high school students and other students on our district campuses. Is that fair? All right, that's all for me. Thank you, guys.
Thank you.
Yeah, hi. So this is not my first time here, but the first time doing this. I guess I'll start out saying similar things that Ben said in his speech in the beginning. I think most gun students as well, the first reaction was, if they're canceling prom, why aren't they canceling school? If they're canceling all these events, why aren't they canceling school? And I think it's important to note that a lot of the student sentiment is still very much grounded in how can I get away with having the most fun and doing the least amount of work, not necessarily what is the most safe, essentially, in this context. So I do agree with some of the things that were said earlier about if school was to close, I think it would not be a situation when students would just decide to stay at home and do nothing. They would very much probably still be active, but that is giving the current circumstances in which I feel like right now a lot of people are still treating this as it doesn't affect my age group, I don't see people near me getting sick, therefore it's not a problem. But obviously this is a virus that spreads and will continue to spread and will worsen in the future. So I don't know necessarily if the sentiment will maintain like this, but it certainly is what it is right now on campus. So I guess I had a couple, so there's a lot of students that are coming to me basically asking about the option of remaining home and the online flexible learning option. So I guess I had a couple of questions about that. For one, what would school look like for those students? So essentially, is it just we're going to post the slides on Schoology and you'll look at it yourself, or are there additional online resources that would be given to them that is not given to students that decide to remain at school?
So I think what Dr. Austin's opening statement was that we have a team of instructional leaders and administrators working right now to figure out what that looks like. It is not going to be the same. It will not be as comprehensive and it will not be the same. There is no way to replicate what's happening in the classroom at home through Schoology. It will, I cannot say that enough, it will not be the same, especially for secondary students. And the course specific details that are required for each of the choices that students make for their course selection.
Another, I think this is more specific, but would the work that they're ultimately going to be missing because they're not in class, is that some work that would be required to be made up later after perhaps a 10-day period that they're excused, or is this work that they're just not going to be able to make up, or whether that's a test, assessment, homework, whatever that comes in?
So again, that's something we're working through that was also referenced earlier, which is, some of the unknowns that we have to figure out are related to notations on transcripts or course completion requirements, what that means, and part of that is also related to the unknown right now, right? Are we, what is happening and how long are people out for? So we try to figure that out right now.
Yeah, so I think a lot of the questions probably aren't, there's not a lot of clear answers to right now, so that's fine. Another one was, so if school, I know that it's right now there's very much a push that we don't want to end school if possible, or cancel school if possible, but in the case of scenario, if it does happen, would school be pushed back and resumed later, and to the same length, or would it be kind of canceled and then, don't know.
Yeah, no, that is what the waiver's for. So if the county agrees or mandates our closing, there would be no requirement to extend. In fact, their recommendation is that we would not, but that would be a discussion for our board to have.
And then I guess the final question that I had was, I know for a lot of seniors, for example, I'm taking living skills right now, which is a graduation requirement, and there's CPR tests that we have to do, that's also a graduation requirement. So there's a lot of concern about if school ends, and there's a lot of things that haven't been completed yet for seniors that are graduating. If those graduation requirements, we find a way to meet them, because I know for CPR it requires guests to enter campus, and there's questions about that. And in the case that those can't continue, would those graduation requirements kind of be just waived, or sorry, this is a really specific question. I don't know if you have the answer to that either. Sorry. Yeah.
Two things.
I detect a personal element to this, right?
Yes, there is.
Two things. You should have already taken that class.
At least I'm showing up.
I'm so disappointed. We're working through all that right now. I'd say there's no reason to get anxious about that right now.
Yeah.
We'll have a bunch of those answered shortly.
All right, thank you so much. I really appreciate everyone that's working on this. Obviously, asked a lot of specific questions, but I understand that there's no answers right now. Yeah.
Great, thank you. I think my questions have been mostly answered. I did want to just add to what Dr. Austin said in terms of the role of the public health department. I mean, this is a confusing situation and a difficult one, right? Because this is not a situation, this is a black swan type event. No one really has experience with events like this. Most of the references I see are to the last pandemic 100 years ago. So we are in uncharted territory. And the question is, and there are no lack of, everything from talking heads on TV to chain letters on Facebook. My wife works with a number of Nobel Prize winners over at Stanford, and one of the Nobel Prize winners forwarded the same debunked chain letter that I got from one of my high school friends on Facebook a couple days ago. So it literally reaches every place, and there are all kinds of more or less informed views. So the question is, who do you trust and who do you rely on? Dr. Austin said his trust has been placed in the public health department. And I think there's a fair question about why we're relying on them. the county health department isn't an agency that we spend a lot of time with. It's not, we don't think of most of us probably never think about our county health department. So, and that's I think a fair question, and one that I've thought about, because we are relying very heavily on their guidance. So one of the things that I look at is, well, who are these people? And the main person, the person who is the county health officer is Dr. Sarah Cody, who, as Dr. Austin mentioned, is I think a lifelong resident of Palo Alto. I'm not 100% sure if she went to our schools or not. She's an alumni of our schools and a member of our community. I'll just read you just a couple of elements of her biography from their webpage. Since 1998, Dr. Cody has worked as the deputy health. This is when she was appointed to her current position, 5 years ago, 6 years ago. Since 1998, she's worked as deputy health officer, communicable disease controller in Santa Clara County, where she oversaw surveillance and investigation of 83 reportable diseases, conducting investigations of outbreaks, participated in planning of public health emergencies, infectious diseases, bioterrorism, and responded to SARS, H1N1, and other public health emergencies. Dr. Cody graduated from Stanford University. She received her doctorate of medicine from Yale University in medicine following an internship and residency in internal medicine at Stanford University Hospital. She completed a 2-year fellowship in epidemiology and public health as an epidemic intelligence service officer with the Center for Disease Control and Prevention. While in that role, she investigated an international E. coli outbreak that was linked to unpasteurized apple juice and led to investigation of salmonella outbreaks centered in Santa Clara County. This experience in Santa Clara County led her to join the public health department after she finished her training. I try to think, is that a person that I'd want to rely on in this situation? And I have trouble thinking of a person who would be better trained, more experienced, and more invested in the success of the decisions and recommendations that she makes than a person like that. I know also from the conference calls that some of us have been on, elected officials, that embedded with the county health office are members of the CDC and the State Department of Public Health, all working hand in hand directly to address the situation in Santa Clara County. So, with the training, with the background, the depth of experience, and bar none, the best information on what's actually going on in our local environment, really they are the definitive source of the infection in our community. I feel, I find it very hard to substitute my judgment or really anybody else's judgment for the judgment of these professionals. So, that's a hard decision, and I can see other people arriving at other ones, especially when you see compelling things, spoken by people with lots of pedigrees and, positions. But, this is I would think that epidemiology and public health is a local, we would call my business a local business, where the local facts and circumstances often trump a lot of the general facts and circumstances, or at least make a big difference in the outcome. So anyway, that's part of the reason that I feel good about the approach that we're using. The other is that, as Dr. Austin said, everything I've read about public health indicates that a coordinated response across schools and institutions is critical. If we close, but the community doesn't work with us to quarantine kids when they're out of school, then the effect is significantly muted. If we close and shut down, release kids into the community, but other schools all stay open, then that has a dramatic effect. If other schools close, that has a dramatic effect on us. So this is why, in my view, public health officials exist, because it's very hard to make isolated individual decisions to create a coordinated effect, which is what you need to develop to address something that's a society-wide impact like a pandemic. So anyway, I have found it comforting as we've worked through this the last couple of weeks to see the guidance that we get and see how our agency and other agencies are working together effectively to address something that, to be effective, we need community-wide coordination and support. So I I feel good about that. In general, I think, you guys have done a good job pulling together answers and kind of getting us to this point. There have been a lot of changes. I think going forward, there will be even more changes than we have done so far. All we can do is kind of keep our head in the game and be resilient, continue to be resilient and resourceful as things come up, and keep focused on what has always been our North Star, which is supporting our children and our families in being safe, healthy, and educated. I think we're doing a good job on that. Everything I heard about from today's presentation made me feel like, yeah, there are lots of unanswered questions, but we're thinking about it the right way. We're proceeding thoughtfully, putting one foot in front of the other, not trying to do things that we don't know how to do or are likely to fail. I think one of the big risks in this kind of environment is to overpromise and then underdeliver. Set an expectation of the community about how something will work, and then find a week or two later that it doesn't really work at all, which not only undermines the effort you're trying to make, but the credibility for all your future efforts, because now you're unreliable. We're trying, I think, very hard to not be in that position and to, if anything, under promise and hopefully over deliver. So, let's continue to put one foot in front of the other, continue to stay calm, not panic. I think that's one of the pieces of advice we hear from everybody, and it certainly resonates with me. And keep focus on doing the right things for kids and communicating with our stakeholders and community so that we can, move forward as a community and serve our kids. Are there other questions from the board members on the phone or in person? If not, Dr. Austin, do you have anything that you want to conclude with?
I'd just like to thank, so many people have touched things, and the list is too long, but I do want to thank the executive cabinet. We've spent a lot of time together working things through, and I'd like to thank for everything that's posted that looks really critical, maybe even to some degree unfair. We're receiving some number greater than that of people appreciating the effort, acknowledging that these are difficult decisions that don't always have right or wrong answers. So I really appreciate the trust of the community overwhelmingly, and our teachers and staff, and we'll come through this on the other end. And I think, as weird as this sounds, doing this work together has made the team stronger, and I think it's going to pay off for everybody. So thank you.
All right. Great. So if there's no other comments, no other business, we're adjourned.